If you suffer from osteoarthritis of the knee and the mornings are specifically tough for you, then this exercise routine would be perfect. I'm going to show you how to help your knee joint right from laying down to sitting to standing before you get ready for the day. And right at the end of this video, I'm going to be giving you the most amazing tip that's really helped all of my patients with osteoarthritis. So make sure you watch till the end. Hello everyone, my name is Joy Agude. I'm a chartered physiotherapist and the proud founder of The London Physio. We are a private bespoke physiotherapy service that you can tap into from anywhere in the country. Our services are predominantly virtual, but we can also provide home visits and clinic sessions as well. In this video, I'm going to be showing you 10 of my favorite exercises to help you reduce pain and stiffness and overall manage the symptoms of your knee osteoarthritis. Disclaimer, as always, do not take this as medical advice. Make sure you're seeing someone one-on-one, a healthcare professional like a chartered physiotherapist. This is general information that may not be suitable for your specific condition. But of course, if you needed a second opinion or some advice or you needed a physio, you can definitely tap into our service. It's all the w's.thelondonphysio.co.uk and click book now. I'd be more than happy to help you through one-on-one. If you haven't already subscribed to my YouTube channel, then please go ahead and do so. I would be so grateful. Make sure you give this video a thumbs up as well. And of course, remember to click the notification button so that you can be the first to learn about our next video. Now, without further ado, let's get into the video. In this video, I'm going to teach you a little bit about osteoarthritis, what it is. I'm going to break it down for you. I'll tell you a little bit about the symptoms of arthritis, how we grade arthritis. Most importantly, I'm going to go into the exercise routine that I've got planned for you. Now, although I have said that this is a morning routine, this routine can really be done at any point in the day. I'll take you through the exercises you can do laying down, then the exercises you can do sitting up, and then the exercises you can do standing up as well. And remember, right at the very end, I've got a super important tip for you. So make sure you watch the video right up to the end. So let's start with what osteoarthritis is. If we break down that massive word, osteo actually means bone, arth means joint, and itis means inflammation. So it's inflammation of the bones in a joint. And if you think about what a joint means, it's where two or more bones meet. Which brings me to the point that in the knee, you actually have two joints. You have the main joint that we actually stand on. It's the weight-bearing joint of the knee. The tibia and the femur. So the femur is the thigh bone and the tibia is the shin bone. So you're standing on that joint. In between that joint, that's where you have the menisci, as in meniscus times 2, and you have things like your ACL, your PCL, all the important ligaments of the knee, and then on the side you have your MCL, LCL. They're just ligaments that hold the joint together. So that is one of the two joints of the knee. That's your tibiofemoral joint, the joint that you stand on, the weight-bearing joint. Now there's another super important joint of the knee called the patellofemoral joint. So it's the joint that your kneecap makes with the end of your thigh bone. Now this joint, you don't actually weight bear on this joint. This joint involves sitting. So if your knee gets irritated when you're sitting, or if your arthritis is in this joint, you probably wouldn't feel it as much when you are putting weight through the knee. Whereas for the tibiofemoral joint, you will feel it when you're putting weight through the knee. And that is the major difference. Now your arthritis can be in one of the two joints or potentially be in both joints. Now, in a joint where two or more bones meet, say this was your femur and say this was your tibia, both bones would be like that. They don't touch. There's a bit of a gap in between both bones. On each bone, you have something called a cartilage. The cartilage pretty much lines the bone. When you have a bit of joint space and smooth cartilages, then movement becomes easy. Within that joint space, you have something called synovial fluid. Now, synovial synovial fluid makes it even easier for movement to happen because it reduces the friction between bones. It encourages the joint space, lubricates the whole thing. Think about it like an engine oil, okay? So it goes in there and makes everything nice and smooth. However, when you have osteoarthritis, what happens is the lining around the bones start to wear. The joint space starts to get smaller and smaller and smaller, and eventually the bones touch. And so that's what happens to the cartilage. It all just starts to rub against each other, and that's when you start to get swelling, pain, redness. Sometimes it feels hot to the touch. That's heat. These are all signs of inflammation. The other thing that happens is that as you get into the severe stage, so you have the mild, the moderate, the severe. As your osteoarthritis gets into the severe stage, you also have things like osteophytes, which are just bony growths happening on the end of each bone. And so it makes life really difficult when it comes to movement. So in a nutshell, that is actually what happens with osteoarthritis. The reason why I take my time to explain this to my patients is because they feel that when they're doing nothing, there's no pain. And once they start to move, the pain gets worse. But you need to understand that it's the lack of movement, the prolonged inactivity that actually causes pain and stiffness. So the more you move, the more synovial fluid is generated within the joint and the easier it becomes. This is also why the mornings tend to be the hardest time, especially the more severe you get. The mornings tend to be really difficult because you've been laying in bed all night. But that could also happen during the day. If you've been sat for an hour, 3 hours or 4 hours, depending on what stage you're in. If you're mild, then that time might be longer. If you're more severe, then that time might be shorter. But certainly at night, we're all sleeping for a certain length of time. So first thing in the mornings, people with osteoarthritis really struggle to get going. But as soon as they start going, they do a few things, it's easier. And that's because there's a lot of synovial fluid now produced within the joint. And then of course the muscles have warmed up, the ligaments have warmed up, and generally joints, muscles, ligaments, tendon, they all enjoy movement. One of the worst things you can do for your body is be still, arthritis or not. Everything from your back to your shoulders to your knees to your hips absolutely loves movement, especially when it comes to osteoarthritis. So the key here is to try and find the movements that work for you, depending on what stage you're in terms of your osteoarthritis. So generally, these exercises would be really good to help you maintain range of movement, improve your strength, increase the synovial fluid that's being produced within your joint, and ultimately deal with the pain and inflammation within the joint. So let's get to it. First thing in the morning, you're going to be laying down. So we're going to start with knee flexion and extension. What you want to do is just bend your knee, bring your heel towards your bum, and then straighten your knee. Try and get the knee as flat as you can into a straight leg position, and then bend it back again, straighten it again, bend it back again, straighten it again. The first few might be really tough. They may also not be very full, so you might only get half a range or like a little bit of a range. That is totally fine. But then as you do more and more, you're able to straighten your leg or bend your leg all the way. Just do what you can and increase the movement. For all of these exercises that are range of movement related, meaning we don't have to hold at the end of range, I want you to repeat about 10 to 15 times, whatever feels comfortable. Exercise number 2, you're in the same position. We're about to do a straight leg raise. You can have the leg that you're not exercising yet, you can have that bent, and then the leg that you're about to exercise, I want you to have that knee straight. And before you lift this leg off the bed, I want you to squeeze those thigh muscles for me, okay? So try and get that contraction in the thigh muscles. And in order to do that, what you need to focus on is pushing the back of your knee down towards the bed, and then I want you to push your heel away from you, point your toes towards you, and then lift the whole leg as one, just high enough so that your leg clears the bed, at least the back of your knee is off the bed. Hold that position for about 5 seconds, so count for 1, 2, 3, 4, 5, and then down. If you're really struggling in the morning, feel free to just go up and down and up and down. Great job. Exercise number 3 is the final exercise in this position. Now the leg that we are exercising, I want you to go into a tabletop position, and that knee needs to sit directly above the hip. So you're going to put a towel under your foot. From this position, I want you to extend the leg, and then I want you to pull down. But before you start pulling down, make sure you extend the leg as much as you can. In order to extend the leg, you also need to squeeze those thigh muscles. Physically, that knee is still staying over the hip, but you're pushing it away as if you're trying to push the back of the knee away from you. And then you're pulling down with the band or whatever you're using, a towel. You're pulling down with that to add more to the stretch. I want you to hold this position up to 30 seconds depending on your pain, and repeat 3 times. These should make you nice and loose a little bit. So now what we're going to get you to do is sit over the edge of your bed and practice the next exercise. Sit over the edge of the bed, sit up tall, and then I want you to straighten your leg, bring your foot towards you, and push your heel away from you. You're going to be contracting the quads, i.e. the muscles at the front of your thigh. And you're going to hold for 1, 2, 3, 4, 5, and relax. So you're going to do that again. Extend the leg, push the heel away from you, bring your toes towards you, hold for 1, 2, 3, 4, 5. Exercise number 5, from the edge of your bed, what we're going to do is sit to stand. For some people, it may look like putting their hands on, if you have arms for the chair, stand yourself up to help yourself stand up. For others, it may be arms across your chest, so you're using your muscles more, perhaps if you're mild. You pick what works for you, and then you get yourself up slowly and then sit down again. The higher the chair is or the higher the bed is, the easier it is for you to get up. Don't push, don't throw yourself forward. Just take your time with this one and focus on the control in the quads. And when you get up, focus on your glutes holding you in that position and sitting down. Now remember, I told you that there are 2 joints in your knee. The patellofemoral joint is strongly controlled by the forces of the ITB and the glutes. I would always advise my patients to do glutes strengthening exercises. There's so many different ones which I can make in another video. So if you want to see that, then leave me some comments and let me know. I'd be more than happy to put those together for you. Well done for completing the sitting exercises. We're now going to do the remaining exercises in standing. Now remember, depending on whether you're mild, moderate, or severe, you may need to hold on to something when you're doing the standing exercises. If you walk with a walking aid, don't do these exercises without support. So let's get into the standing ones. The first standing exercise is a quad stretch. Stand up nice and tall. Push your pelvis forwards. This is really important. Keep the knees together, bring your leg up and hold your leg from behind. Because it's a stretch, we're going to be holding for up to 30 seconds and repeating a maximum of 3 times. If you're moderate, you will probably struggle with this because you are standing on one leg. So you could do this exercise at the start where you're laying on your front and then you are pulling using a belt or something to pull your leg forwards, but you're laying on your tummy. Now I generally don't like that because I feel like it hurts the neck because you're like laying with your head to the side. Having said that, if you can manage to stand on one leg, but the problem is that you don't have the full range of movement or you can't quite reach your ankle, then feel free to just hold on to your leggings or even just bring the leg up and leave it there. You can rest it on a chair or something. You don't actually have to use your hand to pull up. The next exercise is marching on the spot. Make sure you're holding onto something and essentially just bring your knee up, down, up, down. It helps with the hips, it helps with the knees, helps with the ankles. If you are struggling to do the marching on the spot standing, don't worry, you can sit down and march on the spot up and down. And if you're a little bit more advanced and you've got a small step at home or even just the bottom of the step, then feel free to go up the step, down the step. You can lead with the right leg and come down with the right leg, then lead with the left, come down with the left. Choose where you want to start and then you can progress your way up from there. And because this is a range of movement exercise, we're going to be doing it 10 times. The next exercise is standing heel raisers. Standing on your tippy toes. Make sure you're holding on to something. You're standing on both at the same time and then you're gently lowering down. So what we're doing by standing on both is that we're getting the calf muscles to contract. We're going into what we call plantar flexion. And the calf muscles, the gastrocnemius, the superficial one that you see when you look at people's calf, especially if they're like bodybuilders or whatever, you can actually see it's got two heads. That muscle goes all the way up to the back of the knee, and it really helps the knee. So we want to strengthen it by going up and down, up and down, up and down, okay? 10 times. The next exercise, most people would not think to do this for knee osteoarthritis, but I have mentioned already that the glutes are powerful controllers of the knee. So this is a walking sideways exercise. Now, if you have a kitchen worktop and you need support, that will be a really nice height for you to hold on to, and also nice length for you to walk across. So you essentially walk to the right and then walk to the left. Take big steps as much as you can. In more advanced patients, we give them resistance bands to put around their ankles, and then you're pushing as you walk. But for everybody else, it's totally fine to just take these big steps. You're still training those glutes. You're all the way to the right and then all the way to the left. 10 times one way and 10 times the other way. Next exercise is hamstring curls. So you're going to stand in one position, still hold on to your support. This is more like strengthening for the hamstrings, okay? So in more advanced patients, you can use resistance bands. It's a bit like the quad stretch that we did earlier. Your knees stay together and you just bring your heel up towards your bum. If you're doing it without the resistance band, you can actually hold this position for 5 seconds and then relax. So 1, 2, 3, 4, 5, and relax. If not, you just curl up and curl down and do it as a range of movement exercise. 10 times. So those are 10 amazing exercises, and I did promise that I was going to give you a really cool tip at the end. So here we go. Most people forget how important it is to wear the right kind of footwear. A lot of the time, the reason why you wear and tear those joints a little bit too early is because of the amount of impact that's going through the joint unnecessarily. One of the things that we can do to actually help slow down the process is to wear the right kinds of footwear for whatever activity you are doing. Now, if you are a runner or someone who does high impact, the right kind of footwear would mean that you reduce the amount of banging that's going on in the knee every time you pound the pavement. If you are somebody who is just on your feet a lot and you're not necessarily an athlete, busy parents, moms and dads, all of those steps add up. You can wear shoes that will support the arches of your feet. Obviously, speak to your physiotherapist one-on-one because everyone's biomechanics are very different. Nowadays, you can also get recovery shoes, meaning when you are not running, when you are not doing sports, they absorb the impact every time you step on the floor. And this would be a good idea for people that don't even have osteoarthritis, because we already know we're all gonna have it. So you might as well help slow the process down. Now, this is a fantastic tip that people really overlook. Get the right kind of footwear. If you're unsure, you need a second opinion, you just need to check something, you need some one-on-one help, then remember you can tap into our service at The London Physio, okay? So it's all the w's.thelondonphysio.co.uk. You'll have your full assessment. We will make you a bespoke exercise program just for you. Thank you so much for watching this video till the very end. If you've enjoyed it, remember to give this video a thumbs up. You can share this video and remember to subscribe as well. And if you enjoyed this video, then more than likely you'll enjoy watching the videos on the screen now. And until next time, look after yourself and each other.